Hey, I'm Cedric Chambers, and I would like to welcome you to another episode of the 3D Podcast, a masterclass where we share with you everything you need to know about how to transform diversity and inclusion in your organization as well as in your community. We're on a mission to amplify the voices of leaders that are making an impact in the world today so that we can have a better tomorrow. Our goal every episode is to keep it simple, honest, and transparent with you by uncovering the truths in diversity and inclusion with the hope of creating behavioral change, all while presenting it from a unique perspective. So look, if you're ready, get your notepad out, pour you a drink, and let's dive deep as we discuss the dimensions of diversity. Welcome to the show today. I am excited about our next guest. Today, we're speaking with Andres Gonzalez. He is the Vice President, Chief Diversity Officer at Froedtert in the Medical College of Wisconsin. In this role, he provides direction to the Office of Diversity and Inclusion, where he leads D&I strategic initiatives that include business resource groups, community engagement, diversity action team, and health equity, among other responsibilities. In addition to his work at Froedtert in the Medical College of Wisconsin, Andres has worked in the nonprofit sector for over 20 years, where he has been instrumental in creating culturally and linguistically competent programs. In his previous roles, Andres served as the Chief Diversity and Inclusion Officer for Bay State Health, the Director of Diversity and Community Outreach, and Interim Supply Diversity Director at Cleveland Clinic Health System, Executive Director for Hispanic Urban Minority Alcoholism and Drug Abuse Outreach Program, and the Executive Director of Ebaro, a workforce development agency that serves Hispanic and Latino communities in near west side of Cleveland. I'm excited. I know you're excited. So without further ado, let's kick off this show and let's speak to Andres. So Andres, how are you doing today?
I am doing super well. Thank you, Cedric, for the invite and looking forward to our conversation this afternoon.
No, awesome. Look, I'm excited to have the conversation. I know there's some great things that you're working on, so I can't wait to dig into it. And so, look, I know I gave a little bit of your background, and I didn't do it justice. But if you could share just a little bit more about your overall background and how you got into diversity and inclusion space, just so our listeners can understand a little bit more about who you are.
So let me start actually by providing a little bit about my background here in terms of where I'm from originally. So I was born and raised until the age of 13 in a beautiful island in the Caribbean called Puerto Rico. So I'm Puerto Rican by birth, but ended up migrating with our family, right? Looking as many of our parents have done in other parts of the world, looking for that American dream. And we landed in no other place but Cleveland, Ohio. So Cleveland became home, and I spent about 30 years in Cleveland, so Midwesterner by those standards, and was really fortunate that as we arrived there, and certainly I grew up in kind of the inner city of Cleveland, went to Cleveland public schools there. So certainly, product of public schools. I had great mentors along the way who kind of steered me in the right direction and got me involved in community efforts. And that's how I kind of started shaping my lens about the opportunity to make an impact in my own community. Hence how I ended up migrating after getting my degrees, certainly in the not-for-profit sector. I have bachelor's of science in pre-med, thought that I would become a physician, never made it because fell in love with the not-for-profit sector at Hispanic UMADAP, as you read earlier in my bio. And the rest of history. I mean, I was able to see the impact that I can have in being a change agent and giving voice, right, to those who perhaps don't feel empowered in our community. And so that really started shaping my lens and certainly started providing a greater platform for me in terms of the work that I do today. And so was fortunate to stay with UMADAP for about 10 years. Got my master's as a clinical counselor while I was there, and certainly with a minor in cultural competence, which is how I think I started then migrating into true diversity, inclusion, cultural competence work, and then ran a not-for-profit, as you read as well, Barrio, which was workforce development. So that gave me another kind of a great insight and some great ideas of things that we can do differently and better to create community and economic vitality. And then ended up by serendipity landing a partnership with Cleveland Clinic, and the rest is history. I mean, that really opened my doors in healthcare systems and into the work that I do professionally and have been doing professionally for the last 20 plus years in health or healthcare organizations.
Awesome. So I have a question though. So You spent 30 years in Cleveland. So are you a Cleveland sports fan?
I am, true and true. Cleveland Browns fan, Indians fan, certainly Cavaliers. Enjoyed when LeBron came back and won it for us. But certainly, I have to say, honestly, in all honesty, that Milwaukee certainly has been a great place for us, and it gives me the opportunity and the duality, right, to also root for the Brewers and for the Packers. And certainly, I mean, who would not root for the Bucks having Giannis Antetokounmpo, right? Two-time MVP, right, back to back. So it's been fun to be able to be here, but certainly I am a Cleveland fan for sure.
No, that's great. Look, I know a lot of individuals from Cleveland. I did my master's at the Ohio State University. And so,
There you
I
go.
encountered a lot of Clevelanders, and regardless of if they was winning or not, they were fans. Look, I can't speak too much about that because I'm a Falcons fan, and we see how
There
that
you
is
go.
going. so no, to get into our discussion today. So, today, of course, we're talking about diversity and inclusion and its impact in the healthcare space. And so just to go a little bit deeper, can you just take a few minutes and provide a high level overview of the work you and your team are doing at Froedtert?
I will say that, I'm very fortunate that I've been able to do this particular work professionally for three exemplary health systems over the last 10 plus years, because I feel that this is kind of my third version and the right one, right? You start perfecting kind of the formula of what works and how to do it differently and better. And so from that particular standpoint, we have been able to create a cohesive strategy here for the entire health network, where every single goal that we are orchestrating, right, and leading as an organization, we have thought through from an anti-racism, health equity, diversity, and inclusion, right? So we've been able to bake that in. We also have baked in the line of sight, and our CEO, who's exemplary in terms of leading the way, has set the tone and the expectation for leadership accountability. And then we have tied executive compensation. In that capacity, we have been able to touch the entire enterprise, right? So from your traditional and typical D&I efforts around working with HR, around recruiting, retention, development, and promoting, to really working with a lot of operational and clinical leaders around our health equity efforts, to then looking at strategies externally, right, in terms of how to engage our consumers and how to engage patients or potential patients, right? And what's that key differentiator for them and for us to be able to provide culturally and linguistically equitable care, which is always, right, what we promise and what we need to deliver on as part of being an integrated health network here, and providing academic medicine in southeastern Wisconsin. So I've been very fortunate that I have a great team, and that's kind of the strategy that we put in place 5 years ago, wrapped it up successfully about 7 months ago. And then a few months ago, as we all know, right, the pandemic came along. We decided that, we're going to double down on diversity, inclusion, health equity, but we're also going to actually embed, as part of the new frontier of this work, given obviously the longstanding racism, bigotry, and hatred, and the social unrest, looking at things as through an anti-racism lens. And to that point, we are bold enough where we've said we will become the first anti-racist health system nationally. And if we can do it here in Milwaukee, being the most segregated city in America, as you know, Cedric, because you lived here for a while, then it could be replicated right in other parts of the nation. So we're hoping that we will not only influence, but also inspire others to follow suit.
That's amazing. And when you think about the city that you're in, the pandemic that's going on, when you think about just all the different factors that we're facing, right, to still hear that you're doubling down on diversity and inclusion, especially from a health equity perspective, it's just great to hear. And with everything that you all are doing in the organization, I'm curious, having accomplished so much of your work that you're doing, what does it look like to be a high performing organization and be committed to diversity and inclusion? Because some would say that it's difficult to do both when the results of diversity and inclusion aren't always realized as fast as other business critical activities performed in the organization.
That's right. Well, I think you're absolutely right. And it's a key question. I will say that, let me start with that last point that you made there as part of the statement and the question, which is, this is not about this is not about the sprint. This is about the long haul, right? About the marathon. And so you have to stay true to that. It's about looking at creating a strategy, right? So being intentional, being strategic, having senior leadership buy in, that's key. And when you have some of those key factors or elements built into your framework, into your structure, right, as a health system, and you have a CEO who's extremely committed, so much so that she chairs our diversity council, and she has not missed in the 5 years that I've been there. She has not missed one of our diversity council meetings. It
Great.
tells you how committed and how purposeful, right, we are about treating D&I and equity and anti-racism as a business imperative. This is actually not a nice to have, but it's a have to have. Certainly in this trying and unprecedented times. And that, I think, it's what I attribute to being very focused, very intentional, having a roadmap, right, or plan with very clear metrics, right? I mean, you have to understand and really measure, right, and hold the organization and your teams accountable to what success would look like, right, or impact for that matter. And so we've been able to do that at Froedtert and the Medical College for over 10 years now, and hopefully for the next 20 or 30 more as well.
No, awesome. And just to understand that, how has been the feedback with everything that you're doing from inside of the organization as well as externally? What kind of feedback have you all been getting with all of the programs and all the things that you're working on?
I think that when the pandemic hit us, right, and then we saw the second wave of the crisis, which was the economic collapse or impact of that, right, kind of the unintended consequences of the pandemic, and then you have the third one with the longstanding racism. For us, we were able to shift quickly to understand how to support our staff members, our 14,000 staff members within the health network. And part of that was to move them, right, and look out for them in terms of keeping them safe, well, and healthy into a virtual platform so they can continue to do their best work remotely, empowering our leaders. And actually, I was fortunate enough to be part of that work from home team to be able to create a toolkit and leading practices for now this new reality, right, of working virtually on how to stay engaged, right, how to stay productive, what would be the leaders, right, accountability and behaviors and actions, right, in terms of the virtual rounding, right, and touching base with their teams and making sure that they are still, being present and mindful, right? I mean, social distancing does not and should not equate to isolation for anyone. And so we were very intentional about that. Also looking at the well-being of everyone within the system, because obviously we knew that this would be for the long haul, as we're seeing it with the second surge, unfortunately. And then externally, kind of mirroring that, right, in terms of our commitment to our community. And so we're able to double down on a lot of our key partnerships in the community, working with federally qualified health centers who are the safety nets in our communities, and understanding, right, and getting a good pulse of what's going on, what's truly happening from a pandemic standpoint, economically and otherwise, right, through also the social and community unrest. And we decided to not come in with a prescriptive plan, but one where we were showing humility. And based on that, then we were able to co-create, right, as we have continued to deepen relationships and build trust, what the right solutions would be. And so we're able to actually do that effectively and deliver the right, messages, the right resources, so we could actually start educating our communities at large, especially diverse communities and those that are limited English proficient, in a culturally relevant manner as well. So everyone was getting the same consistent messaging, but both culturally and linguistically attuned to their needs. And certainly, at the end of the day, ultimately, right, making sure that people were staying healthy, wearing their masks, social distancing, hand washing, and making sure that they had resources, including, right, where to go and get tested if they actually were experiencing symptoms, the pandemic symptoms. So that's a lot of the work that we're able to do. And I think that what we've heard both internally and externally is that people are grateful that we showed our commitment in this manner, right, that we were all not about words, but about actions. And that certainly we were actually willing to come in and listen first before we actually came up with plans, right? And so that's one of the greatest probably lessons learned in my experience, that you should never come with a prescriptive approach, but one about inquiry, right? Appreciative inquiry to understand better the situation. So that has been probably a key factor for us and why I think we have been successful.
No, that the one thing that stuck out just in what you just said was the education part. And I think that's when you say education is key, that really struck a chord with me, because that education in the various different communities, especially in diverse communities, is paramount, because, sometimes diverse communities can be wary of the motives when it comes to healthcare systems and what is their motive, for me going to the hospital? Is it really to get the care that I need, or is it about the bill? Like, or are they just trying to push me out as fast as I can? Like all these different factors go across. And I know just traditionally going to the hospital has not always been, top of mind, for a lot of diverse communities. So when you think about just, I would call it like this distrust between the systems and diverse groups, like what can we do to build that trust back so that even in a pandemic or not in a pandemic, we can trust that when we go and get care, the individuals and the organizations and the systems that we're going to get care at have our best interests in mind?
That's a great question, Cedric. And I think it starts with acknowledgement, right? Acknowledging and realizing the role that healthcare and healthcare systems, right, have played in the United States historically, right? And we can go back, right? I mean, in terms of the history, and we can delineate countless examples, right? Like the Tuskegee experiment, where over 400 men were actually inoculated with syphilis, right? And they became the guinea pigs, right? And no one told them what they were being inoculated with. And once we even found the vaccine a number of years later, which was penicillin, we still did not provide, right, the cure to those individuals. Many of them went for either blind, but many of them ultimately ended up succumbing and losing their lives, right, to syphilis. And so, when I know that, right, as part of the history, that has been part of the history and the awareness and the education that we provide, right, from a social justice, from a health justice perspective at Froedtert. And it's probably the uniqueness of our health system that our CEO and our senior leaders don't shy away from understanding that, acknowledging that, owning that. And I think that when you go into the community with that humility and that acknowledgement, then certainly starts openings, right? At least the dialogue, right? For us to start getting to know one another. That's how you start building trust. And ultimately, then we can get to a point where we can be sitting around the table, trusting one another, working with one another to create the right solutions, right? And I think that that's how thoughtful we have been at Froedtert in our 10 years of educating, bringing our system along, concurrently, right? Building some of those partnerships, also working with the community. And when we thought that certainly we were ready to bring our senior leaders with the community leaders and the community at large to have these discussions, we're able to do that. And that's probably about 5 years ago, quite frankly, when we also unveiled our health equity efforts. And we were very thoughtful, again, and strategic on how to do that and how to let the community, right, provide their voice, right, the voice of the customer to tell us what is it that they need and what was needed in terms of addressing some of those issues historically and the resources that it would require. And so I think that we have stayed very true to that. Every year we continue to deepen those relationships, which continues to obviously build greater trust especially with our diverse communities. And so I would say that that's really the core element and really the way to do it if you are part of a system somewhere else in America. I mean, you got to start there, acknowledging that, educating yourself, and then owning that as you enter the community, and being truthful and transparent about that and what your efforts, right, or intentions are as you build those inroads or partnerships.
Yeah, it's a journey. This is something to where when organizations such as yours are going down this path, it's great to hear that you're in it for the long haul.
Yep.
And you're really in this to make sure that you're impacting the community and you're there to see the results of what is happening and what all is taking place as you're going through this path. But you brought up health equity. So that is one of the key pillars and one of the things that you all are doing a great job at. So can you kind of go a little bit deeper and walk us through like what is health equity? What does it mean to Froedtert and what you all do?
When I arrived at Froedtert, certainly I was fortunate that I inherited a great foundation, DNI Foundation. We didn't actually had health equity defined. We were networking kind of strategically in terms of having efforts in place, but our chief medical officer knew about it, knew that we needed to start doing that. And so I think that my arrival and building some of those synergies and partnerships actually led to that. And so for us at Froedtert, health equity is about committing to eliminating healthcare disparities and addressing social determinants of health, things like transportation or food security or access to care, right? And so for us as a network is about ultimately providing culturally and linguistically competent healthcare to all of the individuals, regardless of the race, ethnicity, right, language preference, gender identity, sexual orientation, or any other dimension of diversity for that matter, including disability or other abilities. And so health equity has become a fundamental to the organization's mission and simply the right thing to do. And so that has become part of whom we are, how we think, how we behave. You see it in terms of the actions that we have taken, right? Of being deliberate, again, intentional, strategic. You're going to hear those words time and time again, because I think that that's whom we are and how we have been successful, right? About keeping everyone focused on the efforts, creating that leadership accountability, and having metrics, right? Destination metrics to what's going to actually constitute success. And so we actually have 5 metrics, health equity metrics, that today are part of our scorecard and part of the overall organizational dashboard, right? So again, that's the level of commitment that we have. And I think that that's, again, what I've noticed in terms of the difference and really the innovation and the commitment that we have put in place, which is probably different from, other healthcare systems who might be struggling, right? In terms of getting buy-in or support or traction or being able to have those destination metrics in place. So I think that that's honestly the way that I would answer your question about, how do we define health equity and what are some of those things? So I'll give you a prime example. Some of the health equity metrics that we are holding ourselves accountable to, and we're, by the way, very transparent about sharing the results where we stand in terms of current state at any given point, both internally and externally with our community as well, is readmissions, right? So basically, as you get discharge of the hospital, right, if you have to come back for the same issue, right, or symptomology, that means that we still have to take care of you, but it means that actually we will not get reimbursed for it, right? So it hits our pockets. At the end of the day, it actually hits us financially. And so for us, it's not about the financial piece necessarily. It's about, let's do what's right for our patients, for our community, right? If we say that they could be discharged or should be discharged, let's ensure, right, that they have their treatment, their care of plan, that they understand what it entails, that they actually leave with their medications. And so we actually go as deep as understanding and addressing social determinants of health. Things like, do they have the means, right, to buy their prescriptions, either buying medications or putting food at the table, right? So for us, it's really important for us to understand holistically what's going on in each one of our patients' lives, understand how do we actually remove some of those barriers. We have become creative. We're working again with a lot of other wraparound services and community-based organizations to provide some of those other wraparound services. And ultimately, right, it's about keeping our patients healthy and ensuring their well-being in our community, right? So then they can enjoy actually their families and, go back to work or whatever else they really enjoy to do on a daily basis. And so that's really our commitment. And those are the type of things that we're holding ourselves accountable. So, readmissions, we also have diabetes management, which for African Americans and Hispanic Latinos, and actually even the Hmong community, this tends to be also a major issue. And it's one that, it's addressable, right? We can prevent diabetes in our community if people know how to actually have a healthy lifestyle, right? How to eat a little bit healthier. And in communities where you might have food insecurity, where you don't have supermarkets, then we have become instrumental in bringing in food markets, right? So we're actually trying to do and make a difference in our community, and everything is very tailored to the different geographies or communities that we're working with. So everything is very much culturally and linguistically tailored to the communities that we serve.
Well, everything you just said, when you think about being able to think about the cost of medicine, which in some cases can continue to be on the rise, and what that means for your family, and actually going out and if not getting that medicine can mean that you might not even show up for dinner the next day, if that's you trying to put food on the table and be able to provide. And so that education is just paramount. And when you think about I seen a comment yesterday from a celebrity or individual, and they made a comment that was, I would say, not thought out when they made it, but it was about purchasing healthy food with a EBT or a SNAP card. And when thinking about, that comment that they had, it kind of just, took me back a little bit, and just thinking through this process of what options are available, right, to go out and be able to eat healthy. When you think about what you can all get with that card, that's one factor of it. But when you think about what families can afford, what they can actually go out and do, and with the prices of, a lot of the various different health options rising, right? Whether it be organic, whether it be, the non-meat options and beyond meat and all these other type things, it can become difficult to, in some cases, find the quickest and the food that you can get a lot of, right, for the least amount of money, right? Which in a lot of cases aren't necessarily the best health options
Right.
for us as a community. So that education and what you are providing, I think is critical, right? Because, taking care of our bodies now, right, it is that determining factor, right, between those health risks, diabetes, high blood pressure, the things that we're putting in our body. In a lot of cases, has to do with what we have access to, whether you're in a food desert, whether you're able to go out and get these various different options for you. So, as you're thinking through that, right, you talked about, you have 5 health equity metrics that you all hold, and you think about just the success of the overall program. What are the success factors for building a health equity program?
It is being intentional. It's about commitment, right? Because in any health system, there's a ton of priorities, right? I mean, point in case right now, right, with the pandemic and the flu season already that has arrived, right? And all the other key efforts that we're trying to drive as an organization, it's easy, right, to lose focus or dilute the efforts. But what I love about Froedtert is that, again, we have made this a commitment. It is a priority. We have built it strategically, right? Or baked in, we ended up baking it into all of our goals. And then we have very clear metrics that will constitute what success is going to look like, right? For each one of those. And then, so that's the internal piece, right? We also provide educational, cultural competence education, right, to all of our providers, making sure that they understand how to treat our patients, right? And enter each one of those encounters, patient encounters, with that mindset, right? So they're not actually, it's not a cookie cutter approach. And then ultimately on the community side is about, again, understanding what are the issues, again, of the different communities that we serve. And then again, working with our partners there to tailor and customize what those community engagement efforts will be, right? And so for all of those efforts, whether internally or externally, we actually have kind of the same approach, right? So we build it, it's part of our framework. We have the specific tactics. We know who's going to be working with us, both internally and externally. We know what the metrics are. It's part of our balanced scorecard. And we bring all of those efforts and the updates quarterly in front of our diversity council, which our CEO chairs, right? So when you're able to do that, Cedric, then not only it actually allows you, right, to stay focused, but here's the other beauty as well. It's about the investment, right?
Mm-hmm. Yep.
And our CEO has been very clear that when she sees efforts that come to fruition and are the right ones, right, and are yielding the impact or exceeding the impact that we thought they would have, she's willing to invest. Point in case, 5 years ago when I arrived at Froedtert in the medical college, I remember meeting with one of my directors from language services. So all the interpretation services and translation services, that function rolls up into my role as well. And I remember that early on, she said, "Hey, listen, we have an issue here. We now have been moved from just supporting the academic medical center, which they were already honestly treading water as it was, with 8 interpreters for the whole department, now to support the entire system. So now we went from 1 hospital to 3 hospital and over 45 health centers right in our region." And she said, "There's no way that we can provide that, right? With the in-person, we had telephonic interpretation, but we know that our video remote interpretation was obviously not optimal." And so here we are a few years later, where we made a $1.5 million investment. We right-sized the department. We now have 24 interpreters that support, outside of English, the top other 5 languages. So Spanish, Hmong, Russian, American Sign Language, and Arabic, right? With live interpretation. So these are folks who support all of our patients and the clinical teams, employed by Froedtert in the Medical College of Wisconsin. And then we also have brought in a new partner that provides a video remote for up to over 200 languages that are spoken, maybe some of the low diffusion languages in the region. And then on top of that, we also have telephonic interpretation. And when all of that is already, exhausted and we need more in person. So again, that's a great example of how we have committed, right? And have shown in terms of the investments and our behaviors and actions that we want to deliver both culturally and linguistically competent care in every single encounter. And I will tell you, that has been probably one of the greatest game changers in our diverse communities, because everyone is flocking to us. They're coming to us and saying, "Hey, your competitors have decided to shy away or cut back on this when you guys are doubling down and making the investments in this effort. So you're telling us, right, with your actions and your investments, whether we care or not, right, as a community in this region. So that's a great example of how we have continued to close that gap and address the disparities that exist in our region.
That's amazing. As other organizations and healthcare systems are working through this same journey, what provide kind of two questions here? One is, were there any key challenges that other healthcare systems should be aware of? And then could you provide, just two or three kind of key action points that as other practitioners are listening to this call or listening to this podcast, they can go out and start to look at the work they do differently than how they're doing it today?
Sure. I think the conundrum for any EDI team, right, equity, diversity, inclusion team, is that you will probably never be, will have all the resources, right, whether it's staff, your staff count, or the investments, right? You can always do more, right, if you had more resources. And I think part of what we have done, and I think it's one of my lessons learned, and one of the things that I would offer, is you have to be creative. You have to be innovative in your approach. And this work is about inspiring others, is about influencing your key stakeholders, right, to bring them along in the journey, for them to understand, right, how to connect those dots, to become ultimately champions of the efforts or allies as well, and then ultimately, right, deliver on their efforts, right? That's really ultimately kind of the litmus test for my office and being a center of excellence, right, for the system, where I work with a lot of other leaders around coaching and mentoring them and educating them and helping them to connect dots. So that's one piece that I think it's important. But I think one of the other conundrums that you're going to have, not only in terms of investment or FTE, is really, right, how do you keep this top of mind, right, as a key priority? And how do you actually, you're able to inspire a lot of people? And actually, I would say we always hear the issue of the frozen middle, right, the middle managers. And I will tell you that while there might be some truth to that, it's the way in which you approach, right, those individuals. And I think what we have realized, for example, at Froedtert, is that, we know that that's actually the level of leadership that we need to get to, right? Because they're the ones who are close enough to the majority of our staff. So they're going to be the greatest influencers, right, in terms of modeling the right behaviors, taking the right actions, right, and keeping our teams inspired and focused on what the efforts should be. And so what we have done is really, we have kind of inverted the pyramid. Rather than working with a lot of our senior leaders, we know that they get it. So that's not where we need to start. Let's actually focus very intentionally with middle management, work with them, understand, right, the pressures that they have from the bottoms up, right, from their staff, but also the top down pressures that they get from leadership. And we know that they get squeezed in the middle. So for us, it has been about helping them to connect dots, that EDI is not a set aside, but how it actually is woven into their goals. And if they actually do this work effectively, right, and proactively, they're going to be hitting all of their goals anyway, right? So we have been able to actually enlist and really turn a lot of those individuals into converts, into champions, and now they're actually leading the way. And so I think that that's actually something that you're going to have to find a way of engaging that particular level of leadership. And certainly also, right, how you enlist everyone, and including your individual contributors. And so good example of that for us is that when we rolled out our BRGs, our business resource group, Cedric, one of the things that we did intentionally, again, is that for the non-exempt, right, so your hourly staff members, we decided that we're going to actually put an investment in a cost center that only HR and D&I have access to, but that we would not put the burden on the managers, right, especially clinical managers, to allow, right, their members, clinical team members, to come to the activities or events, right, or lead the BRGs, and also be burdened with having now to get someone else, right? So augment their team for that hour, whatever hours there will be, right? And pay out of their cost center. So what we decided to do was actually, we were very thoughtful, rolled out a strategy where we said, hey, for the non-exempt, we're going to pay for that hour, so you don't have to incur in the cost. And then it frees up those financial investments for you to then bring a floater in. So it will be, right, a net neutral at the end of the day, to, right, augment your team there versus having to run an expense, right? Greater expenses. So those type of things, you have to be very deliberate. And because we involved our middle management in those discussions, and they helped us to co-create that portion of our BRG policy as we rolled it out, we got greater traction and support from them and from the overall organization, right? And so we haven't had any middle manager coming back and saying, hey, my team members cannot participate in the BRGs, because many of them were able to weigh in, their voices were heard. Ultimately, their efforts or their thought leadership was baked into our strategy and into the policy. So I think that that's really the things that you certainly have to think through. And the last comment that I'll make here in terms of lessons learned is you can boil the ocean, right? And so start with the low hanging fruit. And for many health systems, it starts in terms of getting your house in order. Start with, working with HR. Look at what efforts you have already in terms of recruiting or retention strategies, or maybe some of the leadership development programs that you might be launching. And so start looking at how you can weave in your EDI efforts there, right? And have success. And when you actually achieve success there, celebrate it, because what gets celebrated gets repeated. And that's a good way, right, of then enlisting not only your internal partners, but then also looking and mirroring those efforts externally as well. But you're going to have to also be mindful of, again, bandwidth and support and investments, even for your own office, right? In terms of how much do you spend internally focused versus externally focused. Luckily for us, because we've been 10 years in the making, we've been able to kind of strike that balance and have a well thought out strategy. But I think that that's where I would actually advise individuals to look at. Maybe get your house in order first. Make sure you have an inclusive workplace that values everyone, that gives you, right, that sense of belonging. And when you have those things there, those factors, and you're working with HR, a number of other leaders, maybe then you can start, right, welcoming the community at large, right, to see you as a workplace of choice. And then ultimately, forging those partnerships externally, not only just for workforce development, but some of the other community engagement strategies that I shared earlier. And I think that that's the way to approach this in a phased in, right, or how you actually build a cohesive strategy over time.
No, that's awesome. And that's a great way to make sure that the programs are working for the employees and for the community versus trying to fit everybody into something that may not work for different populations and different groups.
Right.
And so, this is great. Look, to cap this discussion off, look, I'm a lifetime learner, and I know many of the listeners are of the show. So, as you've gone through your career and as you've continued to do this work in diversity and inclusion, are there any resources or books that you found that's been most impactful for you as you continue to move down this journey?
There's a couple of books. There's actually The Unequal Treatment for those of you who might be in healthcare and you want to learn more about the history, right, of disparities in America, all the ills, right, but more importantly, things that you can do differently and better as being a transformational health system in your own community, right, becoming an anchoring institution in your own geography. I would say Unequal Treatment is a great book. It's actually probably from the early 2000s, but it was probably the book that became catalytic for Congress to actually then have the Sullivan Commission that then actually instructed a number of thought leaders in the healthcare space to put together, the paper, right? The white paper, I call it the brown paper, because it actually started shedding light on how our diverse communities were actually treated unequally and different from that perspective, and what we can do differently and better. So I would say Unequal Treatment is one of them. But then I would say, I think there's given the current state right now, there's a book by good friend Howard Ross, who used to lead Cook Ross, Everyday Bias. I think it's always important, right, to understand in terms of my own journey, individually and collectively, what are my biases, right? We all bring biases, and I think it's important for us to understand and examining our biases constantly. We will never arrive, to your point, right? It's about being a long life, learner from that perspective. I would also offer John Bryant's The Memo, that talks about the ability for him, actually, as an inner city kid, to be able to actually understand how to actually free himself, right, from financial, debt. And so it's actually a great book. It actually talks about equity, disparities, right, some of the things that he was challenged by, and a lot of the work that he led in his not-for-profit efforts at Hope there. And then obviously the latest one that I think it's a must read is Isabel Wilkerson, Caste, The Origins of Our Discontent. I think it's a phenomenal book. It actually will illustrate the caste system that exists here, similarly to caste systems that exist, right, in other cultures, in other countries, and how unfortunate, right, and the impact that it has had in the U.S., in America, and the things that we need to actually unlearn and undo, right, in terms of dismantling that caste system in order for us to start, right, getting into becoming a much more equitable country and society. So those three books, I would say, would be important for anyone who is either starting, enhancing, or certainly just amplifying their knowledge and their overall cultural competence.
And there we go. That was great. Look, I have the memo by John Hope Bryant, a great book. Been able to go through that a couple of times, actually. So look, this has been an amazing conversation. Before we go, do you have any parting words, any shout outs? And also, where can people find you if they want to connect with you further?
First of all, thanks so much, Cedric, for the opportunity to have this conversation with you. This is critical, right? I mean, these are honestly unprecedented times in some ways. In others, I think for some of us who are diverse leaders and our inner city kids, I think many of us will say, well, this has been the reality, right, all along. And the pandemic just exacerbated and exposed the realities, right, that happen in many of our communities. But I think that we've been very thoughtful. I feel that we have reached a level of movement right now that gives me hope, inspires me to do this work much more strategically, right? And in collaboration with a lot of my partners in the community. I just would say a big shout out to Froedtert and the Medical College of Wisconsin, to our senior leadership team there, to our CEO for her commitment, Kathy Jacobson, but also for my team, my EDI team there, who has led the way in terms of operationalizing this plan, and our countless champions and ambassadors and BRG leaders and diversity action team members as well. And then all of our community partners, right? You can't do this work alone. It requires partnerships. It actually requires those synergies. So thank you for the opportunity. And for those of you that would like to certainly reach out, you can either find me on LinkedIn, Andres Gonzalez here from Froedtert and the Medical College of Wisconsin, the greater Milwaukee area, or you can actually send me an email. And I'm pretty good about answering my emails. Is first and last name. So Andres Gonzalez, Gonzalez at Froedtert, which is spelled Froedtert.com. So Andres.Gonzalez at Froedtert.com. So either way, you can actually just send me a message. Happy to connect with people, share some of my leading practices, lessons learned, pitfalls, or anything else that you would like to discuss. But again, Cedric, thank you for this. And thank you for the platform and the conversation that you are creating nationally to start uncovering these efforts. I really appreciate it. And if it wasn't for you to really shine some light on these issues, not sure that we would be here today, right? And that we would be looking at creating a path forward. So thank you for everything that you do as well.
No, thank you. Thank you. Well, look, that does it for us. Thank you, everyone, for joining us on another episode of the 3D Podcast. This has been Cedric, and you've been listening to Andres Gonzalez, Vice President, Chief Diversity Officer at Froedtert in the Medical College of Wisconsin. Awesome. Well, that does it for us. Thank you for joining us on another episode of the 3D Podcast. If you would like to connect on social media, follow me on Instagram, Twitter, or Facebook at Cedric Empowers. And if you have any questions you'd like me to read or answer on the show, or just want to know more about my thoughts around diversity and inclusion, entrepreneurship, or just overall business, you can text me. Yes, I said text me at 770-285-0404. You'll receive content straight to your phone on a regular basis, and you can message back and forth with me. Not a bot or an assistant. All responses come directly from me. Well, look, this has been a great episode. Until next week, this has been Cedric Chambers, and you have been listening to the 3D Podcast. We out.